Estuary in peace flows from the upper reaches. Thus, in the event of high flow from upstream, particularly when the Bagre Dam is spilled, the river flows over its banks, causing flooding. Mr. Speaker, in addition to the above, most of the areas along the upper reaches of the Keta and Noga Lagoon are low-lying, and as such, are unable to effectively discharge storm water runoff into the Keta and Noga Lagoon. The situation is further compounded by the climate change leading to rising sea levels. Mr. Speaker, recently, following flooding in the Volta River estuary, engineers from the Hydrological Service Department, now Ghana Hydrological Authority, visited the site to ascertain the cause. The investigation revealed that the flooding was caused by the blockade of the outlet channel of Anyawi Creek by a sand barrier to the inland channel of the Volta River estuary, leading to the backflow of storm water which flooded the community. To remedy the situation, the blocked channel will need to be dredged to connect the Anyanui Creek to the Volta Estuary inlet to allow flows from the Keta Lagoon into the sea. And subject to availability of funds, this will be done. Mr. Speaker, my ministry will continue to engage the Ministry of Finance to secure funding and take the necessary steps to protect the people of Anlo and other areas across the country at risk of flooding. Thank you, Mr. Speaker.
Yes, Honourable Member. Any supplementary?
Thank you, Mr. Speaker. Mr. Speaker, the economic importance of this river, the River Volta, and the interaction with the sea is of enormous importance. For instance, every year, fishes and other aquatic animals come to sponge at the mouth of the river, which in effect gives enough of the fingerlings to support our economy if they grow up. I've been informed that River Volta, which is supposed to take charge of this important dredging of the lagoon, has gone to hire a dredger recently. When we contacted them, we were informed that Anyangwi enclave of the River Volta, where the sandbar is affecting it, has not been captured, or they cannot work on that aspect. May I ask the Minister whether the Ministry is aware of this and could help us direct or ask Volta River Authority to work on the sheltered portions of the river. Thank you.
Yes, Minister.
Thank you very much, Mr. Speaker. Mr. Speaker, I'm aware of the issue he's talking about. And VRA, some time ago, used to have a machine that used to dredge that area. Unfortunately, that machine hasn't been working for some time. And I'm very much aware of the severity of the problem there, which I have noted that it's part of our plans, and whenever funds become available in our engagement with the Ministry of Finance, we will take the necessary steps to deal with the issue at the Keta and Noga Lagoon. Thank you, Mr. Speaker.
Any more supplementary question?
Thank you, Mr. Speaker, for the opportunity once again. I would like to just appeal to the Minister once again that looking at the severity of the situation, we, the people of Anglo Enclave, we have believed that because of the siltation of the mouth of the river, that is adding to the already precarious nature of the sea erosion. so that the amount involved, the amount that will be involved to defend the walls of the coast, if you could channel something small to whatever the VRA is doing, they will be able to allow the river to flow freely into the sea. Because if the mouth is open, what happens is that the force of the river goes to block the force of the sea, or to break the sea waves. My question to you is that, don't you see that having invested in this dredging will be able to support the economy more than allowing it to deteriorate before we come to build sea defense? Thank you.
Yes, Minister.
Thank you very much, Mr. Speaker. Mr. Speaker, I agree with the honourable member that we need to do some dredging there. And that's also, it also costs money. It's a lot of money to do dredging. And that's why I indicated that we are engaging Ministry of Finance for the necessary funds so that we can do the needful, take the necessary steps. Thank you.
Honourable members, we now move to question number 1735. 1735 stands in the name of the honourable member for K2 South, Ms. Abla Jifar Gomashi.
Right, Honourable Speaker, thank you very much for the opportunity. Honourable Minister, I rise to ask you what steps your ministry is taking to ensure that Act 715 and Article 9 of the Convention on the Rights of Persons with Disability are complied with in the existing Ghana accessibility standard. Thank you, Mr. Speaker.
Honourable Minister.
Thank you, Mr. Speaker. Mr. Speaker, the rights of persons with disability under the Persons with Disability Act 2006, Act 715, specifically in Article 6, access to public places, and Article 7, access to public services, states that, Article 6, the owner or occupier of a place to which the public has access shall provide appropriate facilities that will make the place accessible to and available for use by a person with disability, unquote. Article 7 states that a person who provides service to the public shall put in place the necessary facilities that make the service available and accessible to a person with disability. In addition, Article 9 on accessibility of the Convention on the Rights of Persons with Disability also states to enable persons with disabilities to live independently and participate fully in all aspects of life. State parties shall take appropriate measures to ensure persons with disabilities access on an equal basis with others to the physical environment, to transportation, to information and communications, including information and communications technologies and systems, and to other facilities and services open and provided to the public, both in urban and rural areas. Mr. Speaker, the Ministry of Works and Housing has since taken the following steps. In 2015, the Ministry developed a structured housing policy aimed at addressing housing challenges in the country using well-articulated guiding principles. The policy, as part of these principles, captured inclusivity and compels practitioners to have inclusiveness in the design, implementation, management, monitoring, evaluation, and scaling up of existing buildings. In doing so, the policy requires the state to give recognition to interest, irrespective of income, ethnicity, gender, and social standing. Accordingly, all housing designs are required to adequately address the needs of disabled and the aged. In ensuring the effective implementation of the above policy, the Ministry has facilitated the promulgation of a regulatory regime, the Building Regulations 2022, with legislative instruments number LI 2465, which has incorporated sound standards of the Ghana Building Code. Taking into cognizance of the Article 9 accessibility of all of the conventions on the rights of persons with disabilities, the LI 2465 has made provision for persons with disabilities to access facilities and services open or provided to the public. My ministry will continue to collaborate with all stakeholders, including the metropolitan, municipal, district assemblies, to ensure compliance of the regulations. Thank you.
Honourable Member, any supplementary?
Yes, right, Honourable Speaker, and I thank you for the opportunity. Honourable Minister, I'm encouraged truly that all these have been put down for the benefit of the disabled. But would you have any success stories to share with us on what you have been able to do with the laws that you have given me? Thank you.
Yes, Minister.
Yes, my honourable member. Since these policies were formulated, some government organizations have responded. You know, the Ministry of Labour, Social Welfare, for instance, they have a new arrangement so that people with disabilities can access the various entrances and the various rooms. There have been elevators in other ministries, Ministry of Education, for instance, Ministry of Works and Housing, and others. So institutions are responding. But as you rightly know, our duty at the Ministry of Works and Housing is to formulate the policy. When it comes to the implementation, this is the responsibility of the various district assemblies. They have to make sure that in the granting of permits and all that, all these designs are incorporated in the permit. I mean, in the designs, so that the requisite approvals can be given. So we do collaborate with them through seminars and all that, but the actual enforcement lies with the district assemblies. As you know, our country, we are operating a very decentralized administrative system. Thank you.
Yes.
Thank you, Right Honourable Speaker. Minister, forgive my ignorance, but I just need to know, do you have agencies that monitor the implementation in your ministry? Do you have any agencies that are supposed or mandated to monitor that the law is being followed? Do you have any? Thank you.
Yes, Minister.
Thank you very much, Mr. Speaker. Mr. Speaker, the issue we are talking about is a decentralized activity. It's not within my ministry to monitor. The district assemblies, by law, are empowered to grant approvals of permits. And it is, they are under a different ministry, so they are not necessarily under they are not under our ministry. So our agency are not in a position to monitor. We don't have agencies in our ministry to do this monitoring. But it's the Ministry of Local Government, where these district assemblies are under, that they will be in the position to respond to that question. Our role in this matter is limited to policy formulation, and we have done that. Thank you.
Well, honourable members, we move on to the last question. Yes, honourable member.
Mr. Speaker, I will crave your indulgence to ask one question, given the fact that it borders on disability matters. Mr. Speaker, the minister will recognize the fact that matters of compliance, when it comes to policies, is definitely multi-sectorial. So it's not sufficient to say that my work is only limited to for policy, and that when I do the policy, because it's the AMA or the other municipal assemblies that are supposed to enforce, if they do not enforce the policies that you have enacted with respect to persons with disability, we just leave them to do what they do. Because, Mr. Speaker, I'm saying this because I was in court this morning. And Mr. Speaker, you won't believe that because the lifts have broken down, the entire court complex right here in Greater Accra region, no person with disability can access, the courts. And it's not only the courts, but many public spaces. And so it's almost like we are not being entirely fair to persons with disability, particularly people who are physically challenged. So, Honorable Minister, can you assure this House what steps your ministry can take to collaborate with the other sectors and other ministries and the MMDAs to ensure compliance with these policies that you have beautifully enumerated to secure access for persons with disability?
Yes, Minister.
Thank you very much, Mr. Speaker. Mr. Speaker, as I indicated, we are operating a very decentralized administrative system where the Local Government Act empowers the District Assembly to ensure that these policies having been made by Parliament, these laws and regulations, which are government policies, are enforced. They have every power to enforce this. If the elevator is not working and it's happening in Accra, it's the responsibility of the District Assembly concerned. However, if it is a case that, as a concerned citizen, you have noticed something and you indicate to us, we will take the necessary steps and engage the responsible District Assembly. It's not only about the disability issues, about issues of flooding, issues of on building on waterways and all that. Whenever we get, last week, 2 weeks ago, I'm back on a tour, and areas that were supposed to be reserved, people were developing them quickly. I engaged the Minister for Local Government, and I wrote to the assemblies concerned to take the necessary action. But I just want to make the point that the local authorities, that is the metropolitan, municipal, and the district assemblies, have the necessary powers backed by law, backed by the Local Government Act, to effectively deal with these situations. Thank you.
Honourable members, at this point, I want to urge the Committee on Works and Housing to take up this matter. Enforcement of laws passed by this House. We have what we call post-legislation scrutiny. That is part of the oversight responsibility of the committees. So the Committee on Works and Housing, together with the state enterprises, you can take this matter up and, as part of your work plan, move in to see how far we've gone with the implementation of this legislation. It's part of our responsibility too. It's not just the ministry or only the agencies. It's important that we get this through. If you look at our country reports, our annual country reports, that's one of the deficits that we have. How we respond to the challenges faced by the people with disability. So it's a very important matter, and I think it should be taken up. I hope the chairman of the committee is around. If not, the ranking member, Works and Housing Committee. Yes, please. So note it down, take it up. You can submit a memo on it as to how you want to go around to inspect and make sure that these things are enforced. I'll definitely attend to it. Yes, Majority Chief Whip.
Speaker, just to follow up on your directives, that if it pleases you, we look at it in a more absolute manner, where not just specific to that constituency, because I know the rains will start soon. If the committee could be further asked to look at other flooding or flood-prone areas.
Honorable Majority Chief Whip, you are completely out of order. That's not where we are now. We are dealing with people with disability, not flooding. And the implementation of the laws there too. Yes, we have the last question. It stands in the name of the Honorable Member for Ketu South again, Ms. Abla Jifar Gomachi. Question number 1742.
Thank you, Right Honorable Speaker. I rise to ask the Minister for Works and Housing what specific efforts are being made to ensure that newly constructed public spaces are accessible to persons with disability.
Yes, Minister.
Thank you, Mr. Speaker. Mr. Speaker, the Ghana Accessibility Standard has been incorporated into the recently passed Building Regulations 2022 LI 2465 for the approving authorities. Accordingly, substantial responsibility has been given to the metropolitan, municipal, and district assemblies to ensure permit applications for new buildings are scrutinized to ensure compliance with the laws on accessibility for public buildings, which are stipulated in the Persons with Disability Act 2006 Act 715. It takes into consideration guidelines for wheelchair transfer and movement, design guidelines for older persons, design guidelines for children with disabilities, and design guidelines for persons with visual impairment. Section 60 of the Person with Disability Act 2006 entreats the owner or occupier of an existing building to which the public has access to, within 10 years of commencement of this act, transitional period, make that building accessible to and available for use by a person with disability. Many owners and occupiers of public buildings have since made efforts, especially with the provision of lifts, access ramps, handrails, to make their properties disability friendly. This can be seen with some buildings in the ministry's enclave, such as the Ministry of Works and Housing, Ministry of Finance, Ministry of Gender and Social Protection, Ministry of Employment and Labor Relations, the Accra International Conference Center, the National Theatre, and others. Mr. Speaker, the Ministry of Works and Housing will continue to work with the MMDAs to ensure compliance. Thank you, Mr. Speaker.
Yes. Any supplementary?
Right Honorable Speaker, I have no supplementary question to ask except to urge the Minister to take a holistic look at what we call disability, because it's not only about being partially sighted or hard of hearing or inability to walk. There are many other issues that we need to consider. So I urge you to kindly take a holistic look at disability. I thank you, Right Honorable Speaker.
I thought you were going to draw his attention to the others.
I missed that, sir.
Sorry?
I didn't catch what you said, Mr. Speaker.
The others, you didn't mention. He referred to a number of this, and you said he should take a holistic, and said that there are others apart from what he has mentioned. And I said, I thought you have mentioned some of them, drawing his attention to them.
Mr. Speaker, Mr. Speaker, if you are an albino, you have issues with skin disorders, and so if there's an event and there's not enough shade to protect you, you're at risk of suffering from that. So there are other things to do with disability. It's not limited to just hearing. Speech. I'm grateful. I'm glad that we have a translator here in Parliament who is translating. If we didn't have at an event, then that's a disability. You made it difficult for me to follow what is being discussed. So that's why I urge that you look at it holistically. Thank you, Right Honourable Speaker.
Yes, I'm grateful. I just wanted, for the purpose of education, it's good to add to what he has mentioned. Yes, honourable members, the second Deputy Speaker to take the chair. We finished with questions, and on your behalf, I want to thank the Minister for Western Housing for attending on our call, our invitation, and for responding to the questions of members. Minister, we are grateful. We will now move to public business. Second Deputy Speaker to take the chair.
So we are at the commencement of public business. So we're going on to page 19 of today's order paper and take item 36 on page 19, Speaker.
Well. Yes.
Let me seek
Honourable members.
I'll seek your leave for it to be taken by the Deputy Minister instead.
Honourable members, come with me to page 19. Page 19, item listed 36. Motion by the Minister, in this case, Deputy Minister for Employment and Labour Relations. Yes, Honourable Minister.
Thank you, Speaker. I beg to move that the National Pensions Amendment Bill 2021 be now read a second time. Thank you.
Well. Yes, the Chairman.
Thank you, Mr. Speaker. Mr. Speaker, I rise to associate myself with the motion ably moved by the Deputy Minister for Employment and Labour Relations. And by so doing, I want to present the committee's report. I want the Hansard Department to capture the entire report as having been read, as I take this Honourable House to the page 1 about the introduction and the object of the bill and some bill recommendation. Mr. Speaker, the National Pension Amendment Bill 2021 was presented to Parliament and read the first time on 10 December 2021 by the Minister for Employment and Labour Relations, Honourable Ignatius Bafuwa. The Right Honourable Speaker referred to the bill to the Committee and on Employment, Social Welfare and State Enterprise for consideration and report pursuant to Article 106 of the 1992 Constitution and Orders 125 and 184 of the Standing Orders of the Parliament of Ghana. The committee is grateful to the Honorable Deputy Minister for Employment and Labour Relations, Mr. Wright Reko Grebe, and officials of the Employment and Labour Relations and the National Pension Regulatory Authority for their attendance and for assisting the committee in its deliberations. Mr. Speaker, the object of the bill is to exclude the police service, the immigration service, the prison service, the security and intelligence agencies, and the Ghana National Service, Fire Service from the unification. Mr. Speaker, as I draw the honorable attention to the conclusion Mr. Speaker, in the conclusion, the committee believes while the challenges associated with the unification process under the Act 766 are being resolved, in order not to compound the unification process, the security services should be excluded from the process. The committee has carefully examined the bill, is satisfied with the provisions, and recommends that the House adopts the report and pass the bill. Respectively submitted. Thank you.
Very well. So, honourable members, the motion has been moved, and the ranking honourable member for Pro East, we can now hear you.
Mr. Speaker, Act 766, as originally set out, had a vision of unifying pensions in the country. However, in the course of implementation, and arising out of our own historical antecedents with the security services, implementation has become a major challenge. And whilst the vision of unifying pensions in the country still remains and is a desirable goal, in the short term, it has become important to exclude the security services as a stopgap measure, whilst the major fault lines, which make it difficult to include the security services in the non-security unification, are being resolved. It is for this purpose that your committee recommends that the report be adopted. However, the House must note that this is a stopgap measure. The vision of unifying pensions should not be thrown away with the bad water or with the dirty water. But that vision, we must find new ways of actualizing that vision, because it is important for public sector pension administration. But in the interim, it's become urgent and needful for this amendment to be carried through. With this, Mr. Speaker, I support the motion and encourage the House to adopt the report of your committee. Thank you.
Yes, honourable members, the motion has been moved and it has been seconded. It is before the House for consideration.
Thank you, Mr. Speaker. Mr. Speaker, I rise to support.
Leader, I haven't called you.
Oh.
Okay. Leader, you can now talk. I was looking behind you whether there were people ready to speak to it. So now you can.
Mr. Speaker has been stated. The intention of this bill is to pave way for the establishment of a separate regime to govern pensions in the security and intelligence sector. There is a well thought out policy to make sure that this is exempted, and it also states in the report that the whole idea of the unification of pensions is not going to be abrogated with this exclusion, and that the whole focus on unification of pensions will be followed. And so, Mr. Speaker, I think it's sound. I support the bill. Thank you very much.
Thank you very much. Yes. Honorable Majority Chief Whip.
Speaker, let me speak in support of the report and to commend the leadership, both the chair and the ranking, particularly the ranking member who has shown deep-seated interest in these matters. I'm happy we are gradually bringing finality to this concern. And as the object of the bill details is to unify, to exclude certain other security services from the unification of the pension scheme, and as required by the pension law. I think we are all on all fours. It's important. Clearly, the cap 30 that other security services are very much desirous of seeing, government is pushing it back. It's a refreshing news for other security services, and I cannot help it but to commend government, and particularly commend the leadership of the committee for the speed with which they have dispensed of this work. I hope we go through the process and get it done as expected. On that note, Speaker, I want to commend government for this bill. I thank you, Speaker, for the space.
Yes. Honorable Deputy Minister, you want to say something?
Yes, Speaker, thank you again. And I would want to use the opportunity to thank members for adopting this report. Indeed, it's for adopting.
Has the report been adopted?
I pray that it is adopted. So I'm thanking members in advance of that activity to be done any moment. The interesting thing around this is that the news is that the security services, which otherwise were thinking of, other pension regimes or coming together in a unification process, now will be very clear that they are excluded from bringing them onto the other pension regimes. It's because of the work they do, the risk associated with their work. So if the military is having a pension regime, the Cap 30, which the police enjoy and so on, would now revert to same. And so I'm grateful that members have contributed to this and are going to adopt it. Thank you, Speaker.
Well, yes, Leader.
Mr. Speaker, I think the sponsors of the bill must be commended for responding to the challenge that related to the implementation of the Act. However, Mr. Speaker, I want to draw attention to Article 37.6 of the Constitution. 37.6 of the Constitution, which provides, and I read, the state shall ensure that contributory schemes are instituted and maintained that will guarantee economic security for the self-employed and other citizens of Ghana. Mr. Speaker, this really relates to the self-employed. What you're doing is those of them in government employ. And of course, ensuring that the system is perfected is good. But for all these years, an obligation imposed on us by the Constitution You've not responded to it. It's of the same order as Article, I think, 22 of the Constitution, which provides that Parliament shall, as soon as practicable after the coming into force of this Constitution, enact legislation regulating the property rights of spouses. Mr. Speaker, 30 years, we haven't done that. 30 years, property rights of spouses, we haven't done that. Fortunately, there's one in the pipeline that we must be dealing with. I think we must endeavor to prioritize that. But having said so, I want the minister to avert his mind to the imperatives of Articles 37(6), which specifically relates to having contributory schemes to be instituted and maintained to guarantee economic security for self-employed. We haven't attended to that at all. So let the ministry perhaps engage our own committee on employment and social welfare to attend to this. It's been long outstanding. It can't go on forever. Mr. Speaker, thank you very much.
Thank you very much. Honourable members, I'll then put the question. All those in favour of the motion listed 36 in today's order paper say aye. All those against say no. Honourable members, the ayes have it, and the motion is hereby adopted.
An act to amend the National Pensions Act 2008, Act 766, to exclude the Police Service, the Immigration Service, the Prison Service, the Security and Intelligence Agencies, and the Ghana National Fire Service from the unification of pensions.
Honourable members, the National Pension Amendment Bill 2021 is now read the second time. Yes, leader. Yes, minority deputy whip.
Thank you, Mr. Speaker, for the opportunity. Mr. Speaker, from now to 13th May, the minority side will have their primaries, and who are in our constituencies campaigning seriously against us. We are here doing government business. All I will ask from Parliament is the cameramen, it will not take them to be capturing those who are here for their constituents to know that they are working for Mother Ghana, that they can stay in the chamber. If they are capturing them, all of them, and the people in the constituency are seeing them that, look, my MP is really working. So if somebody is here working against my MP, the person is just is not doing them any favor. It will favor the House. So please, cameramen, capture all the MPs who are here for their constituency to know so that they can stay and do government business. We are working for the nation, and people are there campaigning against us. 7 people for each one MP campaigning against each of them. So please, cameramen, do that work so that they can stay and work. Otherwise, we'll be raising quorum for government business to freeze. Thank you, Mr. Speaker, for the opportunity.
Thank you very much. Leadership, may you comment on this? Okay. Yes, Honourable Chief Whip.
Well, I think it's a popular call. Obviously, from the chairs coming from the background, it's a popular call. And but she shouldn't worry. I know you are preparing to go and have your primaries. Your good works will speak for you. Regardless of the cameras, your good works will speak for you. So go in faith and be confident that your good works will speak for you. I speak in solidarity, in absolute solidarity and in support of her call. But just wondering, the cameras have already been capturing us. The cameras already capture proceedings. So I don't really get it, but I support you know, on any day I'll support you. I support you. I fully support you. Let it be. Let it be. So shall it be. Let it be.
Yes.
Mr. Speaker, if you look at the quorum we have here, I think the Honourable had proposed a statement. I believe that we can take one statement and then call it a day. So I think that I know you have some of the statement before you. We can just take one, and then just one statement and then call it.
Yes, leader, do you want to say something?
Speaker, I'm getting directive from the leader of the House. I think Honourable Deputy Leader should also appreciate the fact that we have a number of statements piled up, and the Speaker has given indication. Speaker, I think when we met, you had indicated that we have about 3. If we could, let's exhaust it whilst we have time or we have less business. So we can manage the time, and then we can take 1 or 2 and draw the curtains.
Very well. We are now on item 7, statement. So we will begin with the one for member for Tamale North on recent measles outbreak in the northern region. So Honorable Alasan Suhini, you may take the floor and read your statement.
Thank you very much, Right Honourable Speaker, for the opportunity. Mr. Speaker, in the last couple of months, since October, over 70 positive cases of measles among children have been recorded in Northern Region. According to a statement by the Regional Health Directorate, the cases so far have been detected in 4 districts, including Karugas, Anarago, Tamale, and Bushabu, where the disease was first detected. Mr. Speaker, sometime last year, the Central Hospital in Tamale had its pediatric unit closed down due to an outbreak of measles. The disease spreads through the air by respiratory droplets produced from coughing or sneezing, making it highly contagious, especially among school-going toddlers. Measles symptoms don't appear until 10 to 14 days after exposure, and this includes cough, runny nose, inflamed eyes, sore throat, fever, and a red blotchy skin rash. Mr. Speaker, the latest development is very worrying because the disease is not just highly contagious, but can lead to lifelong disabilities, including blindness, brain damage, and deafness. Measles is a highly infectious viral disease among children up to the age of 14. The infection tends to be severe in vitamin A deficient and malnourished children, but it is vaccine preventable, and about 23 million lives throughout the world have been prevented through measles vaccination from 2000 to 2018. In spite of this, Mr. Speaker, measles caused over 140,000 deaths globally in 2018. Mr. Speaker, about 95% of deaths due to measles occur in developing countries. 1% of deaths of children under 5 in Ghana in 2013 was attributed to measles. In 2016, a total of 1,218 suspected cases of measles were reported from 195 districts throughout the country. As of 2020, the year that was designated as the deadline for the elimination of measles from African countries by the WHO, 88 cases of measles were reported in Ghana. In the preceding year, 2019, a relatively higher number of 1,274 cases were recorded. Mr. Speaker, given that the international target for eradicating measles by 2020 has been missed, Despite experts' acclaimed commendable strides of our nation, attained through consistent and regular immunization, it is important that the health authorities jealously guide against deterioration of our gains made in the efforts to eradicate measles. In calling for the effective management and treatment of detected cases, it is important that challenges such as civil conflict, weak health systems, cultural and economic barriers to reaching certain population groups during immunization ought to be prioritized for resolution. Ghana may have one of the highest essential immunization rates in the world and may be one of the few countries in sub-Saharan Africa with over 90% coverage with the measles vaccine. At some point, recent data shows a deterioration at about 70% coverage in the last exercise carried out. In the meantime, Mr. Speaker, I wish to appeal to your good office to request the Minister of Health to, at the right time, soonest, appear before your August House to brief members on how government is dealing with the latest deadly outbreak of measles in especially northern region and the collaboration it expects from stakeholders such as parents, school authorities, and the general public. I thank you sincerely for the opportunity, Mr. Speaker. Thank you.
Thank you very much. Yes. Honorable Member for is it Lam or the constituency? Timpani, well, let's hear you.
Thank you, Right Honorable Speaker, for the opportunity to contribute to this important statement made by my senior colleague. Right Honorable Speaker, looking at the number of deaths that occur as a result of measles is needless. I say so because the measles vaccine is there to immunize the children so that they will not get measles at all. So where have we gone wrong? Is it that we don't have the vaccines? Is it that the vaccines are not properly stored? Is it that the cases are not being reported and that the children are dying as a result of measles? Let's look at the measles vaccine. The measles vaccine is supposed to be stored at a certain temperature. But when it is not stored at that temperature, you even give it to the child, it will no more work. So we have to look at the way we carried our vaccines to the various points of immunization to immunize the children. Then two, most of the traditional homes actually don't think that measles should be treated in the hospitals. And that when a child has measles, they put alcohol into your eyes so that you will not be able to sleep and you will not get complications in your eyes as a result of the measles. Because of that, most of the children go blind or they end up by getting opportunistic infections and die because of the lack of treatment. And I've realized that in recent times, the normal immunization education that we used to have is going down. So I think that the Minister of Health should again look at their immunization education so that we'll be able to prevent most of this needless deaths. Let us look at our own homes. Mothers are supposed to be educated on the signs and symptoms of measles or any other condition that has to do with a child. But here is the case, because the education is very low, mothers don't take serious attention to the children when they have measles infection, because people think that has already been eradicated. But in actual fact, we still have measles in our system. And that we have missed the opportunity to eradicate measles in 2020. And that we need to go back and look at the drawing board as to how we can get it done. It is not just measles alone. All the 6 childhood killer diseases are coming back. I learned we have reported some few cases of whooping cough, tuberculosis, and other things, other childhood killer diseases. The Minister of Health has to be proactive in this area to save our children who are our future leaders. Thank you for the opportunity to contribute to the statement.
Thank you very much. Yes, honorable member for Wa Central.
Thank you, Mr. Speaker. And I would like to thank the maker of the statement, Honorable Suhini, for this statement because it's reflecting the need for us to help our young people on a disease that had almost died because of commitment, overall commitment to address the issue. Mr. Speaker, if at this very moment we still are crying because we don't have vaccines for this disease, it's a big problem to all of us. We have heard about it, not just about the fact that it is about measles, but the 5 killer diseases children are vaccinated against. We understand that there's a big shortage in town, and there's a need for the minister to address this strategically and for us to understand exactly what is happening. This issue about measles is critical because we have seen what measles have done to people. We have seen adults who are unable to walk, who are crippled, and who are dehumanized because of their particular nature. We have seen children who are unable to realize their ambition because of measles. And so when we hear that measles have become, the vaccination against it is in short supply, and people are going to go back to the same situation of being crippled at younger ages, Mr. Speaker, it's a serious concern and must be addressed immediately. And it's regrettable that Honorable Suhini is beginning to face this problem at his backyard, at his constituency and places that are close to him. And we do not have to wait until it gets to any one of us. It's important for us to cry loudly and collectively so that we can address this problem once and for all. As I said, we do not expect that at this critical moment in the 21st century, we should be facing the problem of measles in this country. Ghana has always shown commitment to productive healthcare. Universal healthcare is being our challenge, our big challenge, and has been addressed severally. I know that in the First Republic, universal healthcare was tackled comprehensively because everywhere you went, free healthcare was available. It traveled until in the 70s and 80s, it became difficult for government to maintain the trends. And after the 80s, it became apparent that cash and carry would be the definition of healthcare. Mr. Speaker, as we went along, we now have the present system of national health insurance, which is a closed gap measure to address comprehensively health protection for all Ghanaians. Mr. Speaker, I think that this approach must not be let down. Once we fail to continue to address situations like measles, vaccinations, and other vaccinations for kids, we will be defeating the very purpose of our collective healthcare project, which is now, admired throughout Africa and which has become a symbol of attention for most African countries. It will be a shame and it will be embarrassing that it is reported that Ghana is unable to tackle the situation of measles. So, Mr. Speaker, I want to join the maker of the statement for you to, and also to request the majority leader to request the minister to come and address this problem, this teething problem, so that we can be sure that this is not underestimated and that our children are completely protected and that measles will not be seen as an unsurmountable disease that we cannot tackle. I thank you, Mr. Speaker, for the opportunity.
Yes, leadership.
Thank you, Mr. Speaker. Let me thank the maker of the statement, the Honorable Suhini, the MP for Tamale North, for this very important statement. Mr. Speaker, I think this statement is so important because it's not only confined to Tamale North or the surrounding communities. But Mr. Speaker, what is very concerning about this statement
is the state of our healthcare interventions. We've made a lot of progress with such diseases, especially measles. Mr. Speaker, the statement was very clear about the progress we've made. The target was that by 2020 we should have eliminated measles completely. In 2019, the record is that we had 1,218. It reduced to 88. We missed the target in 2020. And today there's an outbreak. And unfortunately, the discussion is that we don't even have the vaccines to deal with this very deadly disease. It has been described. This is a disease that especially targets children and has debilitating effects on children. And Mr. Speaker, it is one of the diseases that we were very sure that we will eliminate. And so, Mr. Speaker, the call by the maker of the statement at the very end of the statement that the Minister of Health should appear before this August House to brief members on how government is dealing with this deadly disease, what interventions are being in place to address the issue of vaccines, is a very urgent one. And I think that we must collectively agree that this must be addressed. Mr. Speaker, we must have our priorities right as a country. Our priorities must be right. We must deal with these deadly diseases first before we think about anything else. I want to thank the maker of the statement and stress the urgency of our intervention. We must do everything possible to quickly get the minister and make sure we clearly understand the intervention plan so that we can deal with all these communities that has been described by the maker of the statement. As we speak, communities in Karaga, Saralegu, Tamale, Bushegu are all under attack on this disease. Mr. Speaker, it is urgent, it is very serious, and we must collectively address this, invite the minister, and make sure that we can understand how we can quickly get the vaccines to deal with this issue. I thank you, Mr. Speaker.
Yes, Chief Whip.
Speaker, let me speak in solidarity and say that I'm privileged to have some very good information on these matters. Yes, the country recorded some shortage, but it's also a fact that it's 3 vaccines that are now in shortage. I think the BCT, the Measles, rubella, and I think the oral polio. All the other 10, we have enough in stock, those to deal with meningitis, penta, and tetanus, and so on and so forth. I'm also told that the ministry has made some commitment. Some good monies have already been paid through UNICEF. And these vaccines, relative the ones to cure measles, are supplied by air freight. And per the arrangement with UNICEF, the vaccines are expected in the country in a fortnight. So that's what I'm told. In a fortnight, the vaccine should arrive. But we'll urge the ministry, if there's something that can be done in the meantime, to speed up, because it concerns lives, especially children. And I couldn't also have agreed with colleagues that the narrative had been that these basic ailments will be out of the system for some time now. It's quite surprising, but I'm happy to know that already the financial commitment has been done by the government, and let's be a bit patient to ensure that we get it. So it's gratifying to know that all the other critical vaccines to deal with meningitis and tetanus, etc., we have it in stock in abundance. What is lacking is the Measles, rubella, the oral polio, and the BC gene. I'm sure that the committee, I'm also reliably informed, the ranking member and the chair yesterday met with the sector minister to discuss this. and he has apprised them accordingly. So, empathize with colleague who made the statement, and it's not a matter limited to that constituency. I think it's a general concern for the country, and we'll follow up. So our leadership will follow up with the minister to its logical conclusion. So thank you for the space granted.
Yes, leader.
Speaker, I think it's important that we commend the maker of the statement, who, as part of his function and responsibilities towards his constituencies and his constituency and constituents, has raised this matter. It's part of the representational function of the member. The Speaker, measles is a highly contagious disease, and so raising this matter is important, not just for the fact that attention will be drawn to his backyard, but that everything should be done to contain the outbreak such that they don't filter out to contiguous constituencies. Because if they do, certainly the rest of the region and indeed of the country would be at risk. The Speaker, the preamble of our Constitution provides that, and perhaps maybe I may quote from the preamble of the Constitution. The Speaker, the preamble of the Constitution provides that the country should protect the human rights as a state. We should protect and preserve the human rights of the citizens. And when you come to Article 34(2) of the Constitution, it provides that the President shall report to Parliament at least once a year all the steps taken to ensure the realization contained in this chapter, and in particular, the realization of basic human rights, a healthy economy, the right to work, the right to good health care. What it means is that health care has been made a right under our Constitution. And indeed, everything should be done under the Constitution to enable a fulfillment of this right that every citizen of this country must enjoy. So, Speaker, it's for this reason that the government of Ghana some time ago introduced the National Health Insurance Scheme. We should work assiduously, not only to expand the frontiers of the health insurance scheme, but to deepen the operation of the scheme, because admittedly, it's getting a bit diluted and should work towards improving it. And having said so, Mr. Speaker, I think I would join the colleagues who have indicated that the Minister responsible for health should be invited to personally speak to these matters so that we have him on record officially as to how the country is working to address this ailment. And it's the reason why, Mr. Speaker, I have always insisted that when such statements are being made, this is not a commemorative statement. It's a statement that relates to that has arisen suddenly in the country and required the minister to be here so that he could furnish the country with details of how the ministry is working to contain it. Otherwise, we are all left in limbo. I understand that some communication has gone on between the chief whip and some high government official. I don't know who. And he is relating to some of the issues that he has heard in the House, which is not official. So, Mr. Speaker, I will urge that if it is possible for us to invite the minister tomorrow, because this is an urgent matter, either tomorrow or latest Friday, to respond to how the ministry is working to contain the outbreak of the disease. Mr. Speaker, thank you very much.
Very well. Is Honorable Alexander Gabi Otozu here?
Mr. Speaker, my attention is being drawn by the Chief Whip, the Majority Chief Whip, to the fact that the Minister was programmed to appear today to respond to this matter. Unfortunately, he couldn't be with us today. And so we should call on him in view of the statement that has been made. Because if he had been able to come here today, this statement would not be necessary. So he should be here tomorrow to respond to whatever he's required to do. Mr. Speaker, thank you.
Member for Gotomi here? It's not here. And Honorable Member for Kaliu is also not here. Is Sala West here? Then Honorable Members, leadership, I come to you.
Speaker, I related to my colleague, and we are minded to. It's past 2 anyway, and we are in your hands, but we've exhausted business for the day. So, Speaker, we are in your hands.
Honorable members, I think we'll bring curtains down. You adjourn the House to tomorrow, 10 o'clock in the forenoon. Tomorrow, 10 o'clock in the forenoon. Honorable members, the House now stands adjourned.